Hi, I'm Dr. Moosa. One of the things that I want to talk to you about today is called venous wounds. What are venous wounds? Those are wounds that occur mainly in the leg areas. They're chronic, meaning that they keep occurring on and off, on and off. They take a very long time to heal up, and usually they're very painful. So I get a lot of patients over here wondering why they keep getting these wounds. So let me explain a little bit that to you. You have a heart that pumps blood down to your leg areas. Now you need the blood to come back up through the veins. But we don't have a heart down there to pump the blood back up. What we have is muscles in back of our calves that when you walk, they contract, and that helps move the blood back up. But since gravity tends to pull everything down, what we have are these tiny valves in the veins. They're basically one-way valves, so they ensure that the blood goes in one direction. But unfortunately, genetics, if there's a family history of vein problems, and most likely females, most likely will get them. Obesity with weight gain and things like that, yes, you'll get those most likely. Pregnancy is one of the factors, so you may have had a child way back, but as we age along, those valves will probably raise their heads up and say, yep, here I am. And then if you've had a history of blood clots and things like that, so there's lots of factors that occur. What can you do at home to help it out? Number one, weight loss. If you can try to lose the weight itself, 1 or 2 pounds a month itself, then down the line will help you out. Number two, if you're very sedentary, if you're sitting along too long, so let's say if you're behind a desk and your legs are down on the floor area and you're there for like a few hours, that does not help the circulation. So you have to move around. So every so often get up and move around and walk around. Now just not 2 seconds walk, walk for about like 5-10 minutes, okay? Other one is sodium. If you're getting too salty foods or whatever, they can also make the legs swell up, which can make the skin much thinner and make the wounds appear itself. Not wearing compression stockings. So if there's a family history of wounds itself in the leg areas, veins, you have to make sure you wear some sort of compression stockings. And the compression stockings have to be nice and tight. They have to be up to the knee area. And wearing them is a cornerstone of any vein treatment. When people come to me for vein treatments, if they cannot wear a stocking because they got a big wound, I will do a compression bandage on them to get the pressure on that to help move the fluid back up into the system so it does not leak out through the veins, and that helps with the healing process. If you do get a vein wound itself, before you come and see me, to go ahead and clean the wound out. Initially people will use alcohol or peroxide, but I tell them after 1 or 2 times, please don't continue using them because that does not help the healing process. You can go to distilled water or saline, and there's lots of other commercial wound cleansers out there. As long as you clean the wound, that's number one. Number two, keeping it covered. A dry wound just stalls on you. It will not get close up. So you got to make sure after you clean it, you put some sort of antibiotic or medicine in it and then bandage it up. And that will help you at least get the wound under better control until you come and see me. So please come by if you have those type of questions. Thank you.